Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffet as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas, sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you grow your dental practice faster. Now, here's your host, Dr. David Moffet.
Hi, everybody, and welcome to today's episode of the Ultimate Dental Podcast. I'm your host, Dr. David Moffet. I'm in Burrawang in New South Wales in Australia. It is just gone after 9 o'clock Monday morning, and today my guest is Jennifer Kahnweiler, who's in Atlanta in the United States, where it is Sunday evening in her part of the world. Jennifer, welcome to the Ultimate Dental Podcast. Nice to see you.
David, it's lovely to see you after all this time. I had seen you in person many years ago, but you have quite a network from listening to your podcast.
Yeah, I think
of people you've collected along the way.
I think I'd just begun speaking when I met you at an Australian Professional Speakers Association event down in Melbourne. I think about 2013. But Jennifer, we've been connected on LinkedIn for a long time, and your posts keep coming up. And I thought you're the kind of person that dentists need to hear from. I've made a few notes about your bio because it's quite an outstanding achievement. Now, you're a doctor, but you're not a dentist, and you're not a doctor. You're actually a real doctor. You're a PhD. You've got a PhD from...
We say that about real doctors. What do you...
Florida State University.
Yes.
So you're actually a real doctor. But you're known as the champion of introverts. And I think that's really important because, and I'll come back to it, you've written 5 books. One of your books, The Introvert Leader, is coming up for its 3rd edition, and you're pre-selling it, and that's still 3 months off. So that's a remarkable achievement to have that in the pipeline, and I can't wait to get my hands on that. You've also got degrees in sociology and counseling from Washington University in St. Louis. So you are very much a very smart person, and I think a person that the dental profession needs to hear from. You've spoken in Australia, Vietnam, Japan, Germany, the United States, Paraguay, and Canada, we've worked out today. So you certainly are a person of authority. So welcome, and it is good to reconnect. And
it is.
Now, Jennifer, let's talk about introverts, because that seems to be the key word that keeps coming back every time I look at what you do. And it's really important because, and I wanted to ask you about the scale of people are either introverts or extroverts? Are they primarily one more than the other? Are they a combination of both, with only some being really extroverts and some being really introverts? Where is it? Is it not a 50-50 split, is it?
Oh, those are a lot of really good questions. So David, the common thinking is that, introversion and extroversion, just to kind of set the stage on what it is, because there's a lot of misinformation about it. It's really in the press a lot now. And, some of the reporters like to have a lot of fun with kind of stretching the meaning somewhat. And, even with researchers, you'll find there's variety, but, it really started back started being used more. And we talked before the podcast with the Myers-Briggs based on Carl Jung's theory of personality, which really said that people get their energy from different places, from within. Introverts are in their heads. They tend to think about things. There are many wonderful characteristics that introverts bring to the table. Whereas extroverts are stimulated more by the outside world. Now, since those definitions have landed, if you will, and people connected with them, particularly through an assessment called the Myers-Briggs, which was really based on a mother and daughter team that analyzed biographies of famous people, and they try to come up with similarities between these different individuals and what the characteristics were. So they created this, they expanded what Carl Jung had done into 16 different personality types. And, if you and your colleagues and other people have taken it, many of us, and I had my aha experience when I took it back many years ago, where you sort of say, wow, I can really identify with this. This explains, a lot of the way I'm functioning. And so I think what we find is with introversion and extroversion, to your question about, are we some of both? Yes, we all have introversion, extroversion within us, but I like to imagine a bell curve, if you will, and that people have a tendency tend to be, if you think about a bell curve with that curve at the top, it's sort of like a mountain and I guess more like a hill, right? And a line down the middle. Most of us are not extremely on one side or the other, but we tend to have a slight preference, or even maybe more than a slight one, a moderate one, towards introversion or extroversion. Now, I will say that the definition of introversion has expanded, and I think in a very good way. Many people, and my colleagues included, think about introversion and extroversion around stimulation, like how much stimulation can you get? Because introverts like people. There's a lot of, as I mentioned, misconceptions around it. And one of the things is, introverts are, they go into a hole and they don't like people. That's not true. Introverts very much like people, but it's how much of that time they can spend with people. So they need breaks. To me, the big differentiator is, or the way you kind of almost the deal breaker, I call it sometimes. Am I introverted? Am I extroverted? I mean, I don't want people to obsess about it, but I do want them to think about, must I recharge after being with people for a certain amount of time? And if you say, I must have that time, it's usually you tend to be more on the introverted side. Extroverts also like stimulation, but they like to keep going a little longer. It's like a battery. They can go longer. They don't need that recharge time. So that's an interesting way to look at it too, that I think maybe help your listeners to think about, where do I fall on the spectrum? Does that make sense?
Yeah, it does. And you brought back a memory for me when I was a practicing dentist, which I did for 35 years, and as a business owner for 28 of those years. And I remember meeting a friend a long time ago, 32 years ago, and he was a very successful dentist. And he said that, when he came home from work as a dentist, he just wanted to lock himself in a dark room and just defrag. And I used to find that was a similar reaction that I had when I got home to my wife, Jane, and the children. They wanted my attention and they wanted to talk to their best friend, but I was already best friended out because I've been best friends to 16 to 20 people through the day, every half hour, every hour, changing best friends, changing conversations. And when I got home, it was kind of like I just wanted to, and so
yeah, exactly.
We moved further away from the office, and that actually gave me more time to defrag in terms of the drive home.
Oh yeah,
It was just turn on the radio, listen to nothing in particular, but just come back to the real world. But there are dentists who will talk, the legs off a table during the day and run chronically late in terms of patient appointments because nobody knows how long their conversations are going to go as well. So it's an interesting comment that you said that most people are a bit of both, and then it's how they respond to when they are with people and then when they're finished with people. That really determines that.
Now, one thing you also didn't mention in terms of stimulation that I think of in my own observing my own experiences with the dental practice I go to is there's also the connection with the staff, right? It's not just the patients. You're having to constantly, either through the procedure, right, or in between patients, deal with your upfront staff in the office, right, and the actual clinical hygienists and all of those folks. So there's like tremendous amount of connection. And I think, to your point, David, I think that there are many disconnects that occur, and they can really turn into major problems with family members, with team members in an office, if we are not aware of this dimension of personality. And that's what really kind of got me into this work, because my husband, who I was a young bride at the time, and I had no idea that he was introvert. I didn't know, neither of us knew about any of this. And he would do the same thing. We would be out at a party, let's say, and he was very sociable. Bill has very good conversational skills. His family was quite social, and he learned all. And so people thought, oh, he's the friendliest person, and he had all these. But then when we would go back to our little apartment, he didn't speak for a few hours. He would go to one end and I would go to the other. And, when I talk about this in my keynotes, and people will come up to me and they're more interested in telling me about those stories, with family members where they had that disconnect and then that aha, because that was the real liberating part, that I hooked on to when I learned about this, and I shared with Bill. And then he was open to learning at that point. He was very listening to me a lot more. We've been married a long time. So he, and it really helped our relationship. And then I brought it into my work in companies where I was working in leadership development and HR and coaching. And I could see quite a bit of concern. I had quite a bit of concern for my clients and my coachees and different managers I work with who were introverted, who were really frustrated, David, really frustrated in those environments. So
you raise a good point about the dental practice and the fact that the dentist have to be the technician doing the dentistry, but then they have to be the owner and make owner decisions. Then they have to be the manager and make managerial positions. They have to hire people. They have to sort out disputes and disruptions within their organization, let alone without talking about customers and their expectations not being met. And then they have to be nice to everybody who comes in, because the thing about a dental practice is that it's the place where nobody wants to go. Nobody wakes up and says, you know what, I've got $500 in my wallet. I'm going to go down and see what I can buy at the dentist today. They don't think like that. They're there because somebody has told them they have to do something to avoid pain or maybe get some appearance benefit, but it's the appointment that everybody wants to cancel. So dentists have that in the back of their head as well.
Exactly. But I'll tell you what my experience has been, and that is, I'm sure many others can relate to this, communication is the key. I have a dentist now that I absolutely have so much respect for, and I don't fear. I've had a lot of problems with my teeth through the years. I'm one of those that I guess genetically, I've got, my dad was like that. I make many trips to the dentist, but I can tell you that my dentist, and I'll give him a shout out here. I'll send him the podcast so he can listen. Maybe he'll give me a discount, David. I highly doubt it, but maybe.
They don't do that.
Okay, well, I'll mention him, Dr. Al Nardone. And one of the reasons that my husband and I were so relieved to find him after many times with dentists where we would find that the lack of communication. I'm sure they meant well, but they didn't explain what was going to happen, the procedure, talk about costs like openly, just really be transparent. And they didn't have to be chatty. It wasn't like, that's not what we were looking for. We're looking for clear communication and listening to the patient about their concerns. When you mention the person who's nervous and anxious, is the dentist taking a few minutes to explain, to hear their concerns? I would argue the best dentists do that, just like any other healthcare professional, any other, right?
Yeah, I
agree.
Every customer in every industry needs to know with clarity what the next step is going to be.
Yes.
It just can't be, I'm getting it here at the moment, oh, you've hired a landscaper, let me design my garden for you, rather than, don't you, I've got to look at it every day for the rest of my life. I want the garden that I want. Let's work with me as to what my expectations are.
Exactly.
And so exactly the same with the patients. I think every dental patient wants these three things. They want things that are going to look good, feel good, last a long time, and then they want things that aren't going to cost much. Well, I think the cost is, if you want something that looks good, feels good, and lasts a long time, it's going to cost, and that's important to explain that.
Explain that exactly.
But
exactly. And I want to just say, if we connect this to introversion, I really want to stress this. I want to stress this because part of what introverts do really well, we did a research on influencing people and how do you provoke change? How do you create connection and inspiration and all of these things that good leaders, and I would argue good dentists are good leaders, right? Because they're leading their practices. So what do they do really well? And if you could relate to some of these, first of all, they prepare. They're very good at preparing. So if I'm a new patient, and our dentist did this, if I'm a prospective patient and I'm going to have a consult with you, you're going to at least find out what my history has been, or at least a little bit about me before you come in cold. And that goes miles, to a patient, to know that you actually looked at the chart, beforehand. Right. They also take quiet time to reflect. And I know that's in a busy office. That's got to be really hard. But certainly during that lunch break or, building in times, not taking an overload of patients. So like you said, you're running from patient to patient. The other thing is listening, engage listening. We found that to be another skill that introverts have that is always mentioned by people when they, talk about the people that have influenced them or have led them. They listened to me. They had a focused conversation with me. If they needed to make a point, they listened to me and then they shared it clearly what their point of view was. It's not just like listening all the time, because then you'll never get through the procedure. But you talk to people and you communicate and you listen. And I think those were some of the skills. There are a lot more, but I think if you think about a person who is extroverted, and they may mean very well, and I have to tell you, I am an introvert ally. I'm actually extroverted, but I've learned this from the introverts in my life. And if I'm talking all the time, I can't hear what the concern is. And I can't get to know people. I need to be listening. And so, obviously you have some advantage when the person's down in the chair and they don't have that power to talk to you. But, you can take those breaks and be focused on concentrating on doing what you're doing with the procedure. But I think if you can think about the preparation, the taking the quiet time, and I'm sure thinking about the case, you have to analyze, right? And go deeper thinking. If you're running around from, patient to patient, or you're frantic and you're not organized in your practice, that's not going to allow you to give those patients what they need and to really give them the best care. So I think it really has tremendous relevance to a success in a dental practice.
Really good point, Jennifer, because the downside of not listening is that you end up with a high churn factor. The patients leave because they don't feel valued, they don't feel understood, they don't feel listened to or heard. Yeah. So they leave. Yeah. So you've got to replace them with more new patients. And every time you get a new patient, there's relationship building, whereas an existing patient, you have built a relationship with them and they are easier to talk to, easier to present treatment to, and they accept it because they've built that trust factor. There are some practices and some locations where there aren't enough dentists, so dentists don't care about relationships. They just churn through. There's always, people at the door. But in today's society, where there's, they used to say there was as many dentists in America as Starbucks, but there's actually more dentists than Starbucks. So, there's one on every corner. They used to say there was a Starbucks on every corner. Well, there's a dentist on every corner in the United States. And so learning how to put these two worlds together is really, really important, because dentists are really only trained on how to do things with their hands. Their education is like that. Then they're sent out into the workforce with a certificate, get a job, find some sucker dentist who will teach you the things that the university did not teach you. That's crazy.
It is crazy. It's totally crazy. But that happens in a lot of industries though too. I mean, I've seen it with the technical folks in my communities who I've worked with, where they're very good at what they do in the engineering or IT, but they don't learn how to work on a team or to lead. But that can be taught. And I think, again, I want to bring the staff into this because they are part of the whole experience that the customer has, right? Or that the patient has. I'm sure you work with in your consulting, David, with that aspect as well, because if they're happy, right, then the patients are going to be happy too, because you're treating from the minute you walk in is the person giving you a greeting, another thing that I think they can do is help develop their staffs as well, so that they constantly feel like they're learning, which they have to, right, to keep up. You know more about that.
It's interesting you should say that, Jennifer, because when I looked at the patient journey through the dental office and looked at really the dentist only has three things to do with the patient, yet the patient goes through a journey of 16 or 17 things. The dentist greets the patient, treats the patient, and farewells the patient. But other than that, the patient arrives. The facility has something to do with it. The people out the front have something to do with it. The people who bring the patient down to the treatment room, the people who are there in the treatment room when the dentist leaves to go somewhere else and comes back, and then also the checkout procedure is all handled by a team, yet dentists don't train their teams in those sorts of things. Very few dentists train their teams in how to answer the phone properly, efficiently, and better. And in fact, the public actually, my wife teaches dental office people how to answer the phone. Somebody said, is that actually a job that you've actually created a business out of that? How hard can that be? Well, it is hard. It is hard to get it right. And, it's like baking a cake. It's like going on MasterChef. It's like baking a cake. You can't put the icing on before you put the cake in the oven. It just doesn't work. And so you can't get... you've got to find out who you're talking to. The number of calls we listen to where they don't even find out who they're talking to, because I think they hire extroverts on the phones, and those people just want to vomit information without even finding out who they're talking to.
Exactly. And now I understand they have AI answering a lot of the calls now and making the appointments and things like that. So that's another thing to be cautious of. I'm not saying it can't work, but, I think it's also how the dentist is treating his people, and he might have some introverts on his staff that he's not aware of. So he needs to bring the best out in them as well as the patients. Just taking a few moments to think about personality. Like, it's not the only indicator of how somebody is. Certainly there are many ways in which we're formed as human beings, but, you have age, you have, ethnicity, you have gender, a lot of these things. And then if you think about introversion, extroversion, or maybe there's other issues that person has. So you need to just be thinking about, who am I speaking with right now, and train your staff in that way too, that not everybody is the same in your office. And I think that will really help you have an office that's welcoming, that is, people aren't, like you said, David, just so afraid that, that just dissipates as they go through the process, and they will come back and they will refer people, right, to your practice. And that's how we get new business.
People will always take a recommendation. Have you seen this movie? Have you eaten at this restaurant? They will take on that recommendation, unconditionally sometimes.
Totally.
Totally. Dentists fall into that category. Where should I go? And it used to be the same in my town when people came into my part of Sydney where my practice was and joined the Chamber of Commerce. They were asked, where do I go to the dentist? And they say, go and see David at Active Dental. It's going to cost you a little bit more, but it's worth it. But it takes that decision, and that, again, I guess it's a people trait, because some people can get caught in the weeds of making decisions, Jennifer. That's a whole other thing. We all know people who procrastinate their lives away.
Absolutely. And that was an interesting piece we looked at in that book, Quiet Influence. We looked at the overuse of a strength, David, because thinking things through and taking that time to analyze is a real strength. You're not just reacting, but you can do too much of it. And that can paralyze you, right? and you can't be paralyzed in this day and age. I did want to also say something about that it made me think about as you were talking about another experience that I had recently with a specialist in dentistry, and everything went fine with the procedure. My expectation was he wasn't a people person. Like, I read that right away, like just more of the surgeon type, So I was fine with that. But then at the end, he kind of dismissed me, and it was time to go pay. I had no idea what the follow-up instructions were. So I asked the assistant, and she really didn't know. So I think that's a very important piece. If you're not a people person, if you don't like to make that conversation, I totally get that. If you're not into communicating with the patient, but make sure you have people that are trained and are the right people to really connect, and make sure that your patient understands before they leave what the follow-up expectation is for the procedure. And so that when they sent me an evaluation, that's exactly what I wrote. I hope they read it, but you and I are especially tuned to this kind of stuff, right?
I know we are, but I think that it is one of the shortfalls of being a clinician, and a highly skilled clinician, is
Yes.
that you're good at what you do, but you're also not very tolerant of people with questions. And remember,
Exactly.
Jennifer, if you've had these questions, and somebody else has probably had these questions already
Probably.
that day and in that morning, and so it's a repeat of the same old thing. And you mentioned AI. The thing is that I don't think doctors and dentists use enough. In fact, I picked up my physiotherapist on this. She was drawing diagrams of what I needed to do in home exercises, and I said, Sarah, you really should have this just in a program, and you just go click, 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 and there they are. And you know what? The next time I went to see her, she told me, I've got them, I'll do that. And she did. And so everything just came out so much easier and saved her a lot of time as well. I said, because while you're drawing this out, and that's what dentists feel, while they're writing this out, while they're chatting, nobody's actually doing the next patient. And so I
get that for sure.
It should be a delegation. And so when you went to the assistant and asked for it, they should be in a position to say, let me show you what we have to do.
Exactly. And another skill that I want to bring up that introverts tend to have, and if we think about your patients like this, many people, like my husband Bill, would rather read about it than you tell him. Even say, here's the sheet, or here's the link you go to, watch this video, make it visual. People learn in different ways, but introverts very much like to think about it and read, and not necessarily talk about it. Right. So you want to have, to your point, you want to have somebody be able to go, and then you can do the exercises on your own. You can be you in the computer. You don't have to still be engaging. You might not want to stay and talk about it. So have those options for people. Again, knowing that your patients are not all going to be the same personality type, but have options for them.
Well,
and I think,
and you can communicate these things for post-operative of anything, be it a physio, be it at a dentist, with a text message with a link to.
There you go.
There's the document there to a PDF that they can download and what did he say? Oh, there it is there. And you're right, like your husband Bill, They can then take their time and make sure they understand. And and also that link could also have videos on YouTube, because anything that is written is now on YouTube as a video.
Yes, it is. So, David, we have a new product. Maybe we'll come up with a new company here that we can.
The only problem with YouTube, there's a sidebar, and you end up watching dog and cat videos in the end.
Yeah, that's the only problem with that, right? Exactly.
All roads lead to those dog and cat videos. But let's get back to the Myers-Briggs, because that was a revelation for me. I had done a DISC profile, which is just 4 scales, but Myers-Briggs put me into one of 16 different categories. But the thing about the Myers-Briggs, whether the test was 20 questions, 50 questions, or 100 questions, I always ended up in the same category. And I thought, how do they get it so accurate on 20 when I know 100 would be accurate, because all of a sudden you feel like you're answering the same question over every 10.
Right.
How do they do that? And again, it then does tend to label people. I'm not a fan of being labelled. In my diet, I choose not to eat birds and cattle. So I've got this label. I'm called a pescatarian. You know, I was my diet was invented before the word pescatarian was invented, I'm
Yeah.
sure.
Yeah.
So
Right.
I'm not a label fan, but
Yeah.
sometimes
Yeah.
labels stick. The introvert label will stick. Oh, he's an introvert. He's an extrovert.
Yeah, interesting about that. Well, two questions there. I think you asked about the assessment. A lot of people are, people take issue with the Myers-Briggs because it's not validated in the way they would like to see it validated. There's many assessments. There's the Big Five, which is another one that psychologists use. But basically, David, people can go online and Google personality type or introvert and learn and take free assessments. Like there's one that's now online. If you just Google introvert assessment, and you'll find it's very much like the Myers-Briggs. So we've gotten away from sort of all this proprietary information. As far as labeling goes, yeah, I think that is a concern of people. But I just say don't get into that. I mean, it's really just more data for you to understand yourself, and maybe you don't agree with it. Like there are times, or it comes out where it's confusing. You mentioned Myers-Briggs. Introvert is just one for those folks who haven't taken it. It's one dimension. We have introvert, extrovert. Then the second dimension is sensing and intuition. And that's how you take in information. So I mentioned the first one, which is more about your energy, right? And your stimulation, introvert, extrovert. S and N is sensing and intuition. And that's really how you take in the world, how you take in information. Are you more like a detailed, very focused, on the here and now, what's going on right in front of you? Or are you more like big picture, intuitive, is sort of like the future oriented person? I would guess that most people in dentistry are on the S side. And you mentioned you think most are introverts as well. So they're more like, I want my dentist to be more sensing. I want him or her to be seeing exactly what's going on with that crown or the possible root canal. I mean, I don't want her to be thinking, well, it could be this or it could be, and they do some of that, like imagining what the future could be like. But in that case, you want them to be really with the data and what they're seeing visually. And then the third area is thinking and feeling, and that's how you make decisions. So this is sort of a real quick overview of the Myers-Briggs, but I think it might be helpful. The thinking and the feeling, the thinking is being very logical, pros and cons, very analytical. The feeling is not so much that you're a feeling person, that you make your decisions. You really highly consider the other people and the relationships in making the decision. So somebody like myself who's more coaching, counseling, that comes up a little bit higher on mine, than my husband is much more like he's a professor, he's analytical, he's more on the T side. So he'll make a very logical argument. I'll be like, well, what about this and the people and blah, blah, blah. So you have to kind of come up with some, the both are important and they're both critical to talk through. But again, I don't know, dentists, they may be probably more on the T, I would think, on the very logical, analytical, but there are some, not every dentist is going to be that way. And it doesn't mean that you can't use the other side in your work either. The final one is the J and the P, and that's how you organize your life. So a J person is a judging. It stands for judging, even though that's not the word. But J is more about like, you like closure. You like to be organized. You like things, your list and to check it off. Whereas the P is more open-ended. Let's go with the flow, a little more spontaneous. They might make a list, but not look at the list, that kind of thing. So both are important. If you think about going on a vacation, you don't want to be so rigid when things come up that you can't flex. But at the same time, maybe you want to make sure you book a hotel or two ahead of time, you plan. So it's both things are helpful. And I find a lot of times couples or partners will kind of be opposite or have several dimensions that are opposite. And then it works well for the team, as long as they can accept each other too, Sorry that was so long, but I felt like we needed to kind of just clarify what Myers-Briggs was, since it meant a lot to both of us.
And thank you for that, because it is something that I hope those listeners that are interested will go and investigate and look at that. And there are plenty of other tests around it as well. But the Myers-Briggs one did certainly change my view on myself. One of the interesting things I found Jennifer, and it came from a comment that my wife made about our son, when he was 3, and he's 29 very shortly. But when he was 3, she said, he's not a naughty boy, he just does naughty things. And that was separating the behaviour from the person. And
Yeah.
I find that when people say, oh, you're a dentist, or you're a typical dentist, I always said, no, I'm not a dentist. Dentistry is what I do. And using
Right.
that same connection that my
Mhm.
wife had with my son's behaviour. It's something that I
Yes.
do for a living, but I'm David, and there's so many parts of David that are different.
Mhm.
But
Right.
and to what we were talking about before we started the recording, some people like me, I ended up in dental school because I didn't get enough marks to be a doctor.
Mhm.
And I'd already excluded being a veterinarian because I thought those patients can't tell you what's wrong with them. Um, so
True.
that's a really tough one to get into. What's wrong with this guy? Well, woof woof. I don't know. but 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 so categorizing dentists on the way they are. A lot of them do tend to be technical minded people, though. That's the interesting part. They do tend to work well with their hands, and I don't know whether that's a skill that they learnt or whether it's a natural ability. It's like painting, isn't it? Painting
Yeah.
is something that people say, oh, he's a naturally gifted artist, but it's just about learning how to turn shapes into curves, really, and blend shadows and light. Um, it,
Mhm.
but getting back to the character of an introvert, um, it keeps coming back to me, and you just mentioned this too. People who talk, some people listen to understand, and some people listen to respond. And I would
Mhm.
think that the extroverts are the ones who listen to respond, whereas the introverts are the ones who listen to understand. And you can tell those people in a conversation and in a group conversation because the person listening to understand isn't really contributing much because they're constantly
Exactly.
consuming and they've probably got a
Exactly.
better awareness of what's going on.
Yeah, no, that's a very good point. And I think I don't want to put the extroverts down. I think what they do is they keep the conversation going, like you say, and they will introduce people to other people. If you think about a typical, maybe a dental association meeting where, you have a bunch of folks standing around, the extroverts or people using extrovert type behavior will be more social. They will be, connecting people with each other, which is really the point, isn't it? To try to meet other people. But introverts do shy away a lot from those discussions or those scenarios because they think, well, I don't want to make small talk. But I think if they use their skill and their natural strength in preparing and thinking, for instance, what is it I want to accomplish from going to this meeting, this dinner meeting where there are going to be other dentists? Do I want to meet a couple of new dentists? Do I want to ask about a technique that I'm considering? If you have that in your mind, that intention, that's going to help the conversations along, and particularly if you're trying to meet certain people, do a little research ahead of time so you can ask them about their interests. Oh, I noticed that you like kiteboarding, or, I saw on your LinkedIn that, just to kind of make yourself feel more confident when you're in those. And I kind of shifted it to networking because that comes up a lot, David, in the scenarios that I come across with people. It's, now, especially that we're getting out more, than we were a few years ago. I think we've gotten a little rusty, don't you, in our skill at really having the art of conversation.
Very true, Jennifer. And one of the reasons that I had a successful practice in my area was that I used to go to the Chamber of Commerce functions and I'd be the only dentist there.
Oh,
So
there you go.
it was an easy market. But when you
Yes.
go to Chamber of Commerce events or
Hmm.
any networking event, you've got to make sure that you're there to meet people as well. And you can't just fall back into that just chat with my friends who I met last month and the month before and the month before,
That's
because
right.
that's then
That's right.
pointless reason for going. The purpose of networking is to meet new people and help to find new people. And sometimes the connections that you make in those sort of events or just in
Mhm.
social events can result in life-changing friendships being established, not just business
Absolutely.
relationships.
Absolutely. And the listening you referred to earlier, David, if you're a good listener and you're meeting people, whether it be at a professional association or not, or a community group or just with neighbors, you never know what's going to emerge from that, right? And so if you're listening, then you can do what the important part of networking is, which is the follow up, which a lot of people don't do. They miss the mark on that. They don't follow up with people. So, you're telling me about something you're interested in and researching in your practice, and I'm able to then say, "Oh, that's something I've been looking at, and let's talk about that more." Or let me send you this article. What do you think about that? So you deepen the connection, because relationships don't just happen from one conversation. We want to get to know people and see if they vibe with us, if they're the kind of people that we'd like to learn from. And there's something called the care and feeding of your network. So I think that introverts do that really well, and so they shouldn't shy away from meeting people, because they can learn so much and also share what they have learned. And I think that's so critical in any, particularly we were talking earlier about, practices can be very lonely places, right?
Oh, very, very much so. Most dental practices, most dentists practice in a one dentist environment only. The owner.
Yeah.
That would be more than 50 or 60% of dentists are practicing in that one environment. Then
Yes.
occasionally they're in partnership, and sometimes those partnerships are more painful than marriages. Let's work together. We're both dentists. Let's work together. They haven't done the homework, and so that you have hostile partnerships, and then of course you have group practices and DSOs as well, where there's a managerial, and then it becomes a corporate structure where there's a lot of what do you call that? Water cooler talk
Yeah.
going
Yeah.
on, and not much dentistry is going on. People,
Yeah.
did you
Yeah.
hear that? Yeah. So again, those sort of environments are there all the time. It's no wonder that when people talk about dentists and people who aren't dentists talk about dentists, they often bring up the comment, "Oh, there's a high suicide rate in dentistry." There's also a high mental health issue that doesn't end up in suicide. There's also a high substance abuse issue as well. And I
Yeah.
guess those aren't related so much to the introversion, but I think that more the isolation
The
of,
isolation.
of the
Right. Right. So I think, to your point, I think it's very important to look for those times when you do take off, when you have some spaces to, do volunteer work. There's a lot of, I know, opportunities for dentists. I know about them tangentially, but missions, to go and help people. If you don't want to do dentistry, that's fine. Go on a travel group that has nothing to do with dentistry, right? And refresh. You and I were talking about how important travel is to our mental health and our well-being. And don't let that, the fact that you have a full load of patients ever stop you from taking breaks. And my dad used to say that when we were struggling in early years of marriage, and he was a freelancer writer, so he was having lots of ups and downs, but he said, do that, make space for those breaks, for getting out of town, because it does refresh you. Whether you think you can leave or not, you must take those breaks. And and you meet different people, and you get your brain stimulated outside of the office, and that will do wonders for you. Book clubs, I understand there are like dental book clubs I've heard of. Is that still a thing? Or professional mastermind kind of groups where you can connect with other professionals?
Yeah, there are, but again, it's finding people with common interests, isn't it?
Yes.
I
Yes.
remember dentists, because they tend to be high earners, tend to shy away from public displays of their income. So they feel guilty about taking holidays. They feel guilty about driving good cars. They feel guilty about living in nice homes. They feel guilty about where they send their children for education. I had a coach who said to me once, he said, when you're telling your patients you're going on a holiday and they say, "Oh, you're going on a holiday," in a derogatory manner, he said, just say this. And he said, just ask your patient, would you rather go to a dentist who takes a holiday or who needs a holiday?
Oh, I love that. I love that.
They say, off you go, Doc. Off you go. Off you go. Yeah, I want you rested.
I'm writing that one down. Takes or deeds. And I have to say, it would be interesting for us, David, to look at if it's the same feeling in the United States, because I don't think dentists have to hide anything. The culture where you are in Australia is much more egalitarian. My experience has been, and so you don't want to be the tall poppy, right? You called it the tall poppy.
Tall
So
poppy syndrome.
here, there's no worries about tall poppies.
No.
From what I can see, it'll be interesting to ask Dennis. I'm going to actually take that on as
I don't
question.
I don't think the dentists, because there are so many of them, I don't think there is a tall poppy syndrome. But down here, definitely. I had a friend who who lived in the country and would drive to the city. He had a Mercedes for doing that, but he wouldn't drive around his country town in a Mercedes because
that I get that. Yeah. Interesting, isn't it? The cultural differences.
Very much so.
And that affects, introversion, extroversion. They're all related, like how these intersect with each other. It's like the key for me in terms of leaders, whether they're being in a small or a large practice, is self-awareness. Is spending the time. We think that it's the technical, the clinical skill we have to keep getting better at. And yes, we do. But it is so important to know ourselves, know thyself, the old expression, right, from Greek times. Know that it's so important that we understand our strengths, our weaknesses, our personality types, and then we can, and that brings us higher emotional intelligence. We can then relate to the people, whether they be our patients, our staff, other vendors we work with. We are much better at relating to people when we know ourselves, when we understand ourselves. So that's why I'm so pleased that you asked to at least consider this topic as one way of understanding yourself. And I hope people will learn more about it.
I think it's a great topic because a lot of times people just don't bother to sit down and look at how they are. In conclusion, Jennifer, when somebody does analyze themselves and comes to the opinion or arrives at the opinion that they are either introverted or extroverted, and they tend to then think of that as not being how they want to be. Is it wise to change? Is it difficult to change? Is the change gradual? Is the change something that can happen overnight? Is there something wrong in being an introvert?
Nothing is wrong. That is a very important point to consider. There is nothing wrong with being an introvert or being an extrovert or being not sure, right? It's really about how we're wired, David. It's how we're wired. There's no judgment. And that's the key thing if you take anything away from this podcast, I'd like you to know that there is nothing wrong with you. Now, there are certain behaviors that are natural to us that we want to keep leveraging. I've mentioned a few of them in this discussion. The quiet time, the listening, the preparation, all of those things that might come naturally to you as an introvert. But you also might want to add to that, like to your point, what can I beef up? Maybe I need to spend more time building a relationship with a patient or with a staff member. That's something, if I know what I'm good at, let me look at how I can keep getting better. And the beautiful thing is the more that we tap into that other side of us, that's not maybe our dominant side, the more we get better at it. We get better. It's like when you have an injury to your non-dominant hand, your left hand, or let's say your dominant hand, and you have to write with your other hand. Then you're not great at it, but you get better over time because of practice. So I really encourage people to get to embrace who they are. You don't want to say to yourself, I don't want to be an introvert. Just be proud of being an introvert. Introverts rock. That's what got you to where you are now. But then also look at, after you've congratulated yourself, then look at what can I do? What can I add to the picture to make myself even stronger?
Yeah, to be a more well-rounded person, I think that, and we've all met people who are so linear in their personality that sometimes it is hard to connect with them as much as we want to.
Yes,
they've built themselves into a lane that is so narrow that it's hard to connect.
Exactly. Well, you're an example of that, David. We think you're introverted, right? We talked about that, and look how a lot of people, you did this podcast, like a lot of introverts I know, to really keep that muscle, to refresh that muscle and keep it alive, of connecting with people, right? Because that's what you do well. So keep doing it.
Well, I've met so many people over my life, Jennifer. It's a shame not to reconnect with those people and
Yes.
share that reconnection with the listeners and the viewers on the podcast. That's what's been my pleasure, and also the networking that happens when I talk to people, and when we finish, I say, "Who do you know who I could talk to on the podcast?" And so then I end up meeting more new people. So it's kind of like a mini networking event.
It's true. I'm finding the same. And it's so funny. I'm laughing with you now as we look on our videos, and it's getting dark here. You can see I keep changing the light. So it shows that we've been having a very great conversation as the light comes up on your end and goes down on mine.
Yeah.
The miracle of working in virtual technology, right?
It's one of those amazing things and I find when I talk to my friends in the US, they have difficulty understanding that Australia is in the future time-wise, which was great when the Mayan calendar was ending. I said, just call me on that day, and if I'm alive, then the world hasn't ended.
So, thank God! Thank God.
So that was
that's great.
Funny about being down here, Jennifer. We could still keep chatting, but it's time to. The sun is setting there, and it's time to say goodbye.
It has. Yeah.
Jennifer, if anybody watching or listening to this podcast wants to get in touch with you, what's the best way?
Sure. Well, my website is probably the best way, where I have a regular newsletter I put out with lots of information. And we also have, it's jenniferkahnweiler.com is the website. And I assume you'll have that in the show notes. So
yes.
We'll put that in there, and then people can subscribe pre-order our the new book, the third edition of The Introverted Leader, which has like over 20% new content and looks at the new workplace, remote hybrid workplace for introverts, as well as many other relevant topics we talked about today. And then finally have a podcast like David, my mentor here, Introvert Ally is called. And that's in full swing now. You can get that wherever you listen to podcasts. So no, it's been a thrill. It's so great to reconnect with you, David, and to learn so much.
Yeah, nice to talk with you, Jennifer.
Absolutely.
And thanks for being a guest on the Ultimate Dental Podcast.
My pleasure. I look forward to staying in touch. Thank you.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being a part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favorite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the Ultimate Dental Podcast. Until next time, keep smiling, keep striving, and keep on tuning in to the Ultimate Dental Podcast.